Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing vitamin D. Before I continue, if you've not subscribed to my channel, you can pause this video now. There's a button below that says subscribe. If you just touch that button, then any new videos that come in, you'll be updated and you can keep yourself well informed. Vitamin D is a vitamin which is a nutrient needed by the body and is classified as a fat-soluble vitamin, meaning it needs the presence of fat in the body to be absorbed well. Vitamin D deficiency is the most common nutritional deficiency in the world. Vitamin D regulates calcium and phosphorus absorption in the body, and this is important in maintaining muscles and bones in the body. Vitamin D can be found in two forms, which is vitamin D2 and vitamin D3. I will tell you how we can obtain vitamin D3, as it can be obtained from sunlight. Our bodies convert cholesterol to 7-dehydrocholesterol, which is found in the skin. This, when in contact with UVB radiation from the sun, is converted to cholecalciferol, and this is broken down in the liver and kidney to 1,25-dihydroxy vitamin D3. Both vitamin D2 and 3 can be obtained from food sources, which include oily fish like mackerel, tuna, salmon. Other sources include egg yolk, meat, milk, and mushrooms. There are some foods that are fortified, meaning they have vitamin D added to it to enrich it, and this includes fat spreads, yogurt, and cereals. There are some factors that decrease the absorption of vitamin D or make vitamin D not available in the body. As you can see, most of vitamin D is obtained from sunlight. So those who live below 35 to 37 degrees north latitude are at a disadvantage due to the position of the sun, and they might have less vitamin D, especially in the winter months. Those with darker skin are prone to having a decrease in vitamin D because the pigment, which is melanin in the skin, absorbs part of the vitamin D, which should be absorbed by the body. So those with darker skin might need more sunlight to actually get enough in the body. There are some people that, either due to work or religion or other social factors, are not exposed to sunlight, or their body is not exposed to sunlight, and they are at increased risk of having less amounts in the body. Those with increasing age, due to breakdown of the skin, they are also prone to reduced level of vitamin D. Pregnant women and breastfeeding women are also prone to reduced levels. Those that have problems with absorption in the bowel, things like Crohn's disease, celiac disease, and even gastric surgeries, are prone to less amounts of vitamin D. For some that have had surgery of the bowel, especially the stomach, they are at increased risk of reduced vitamin D. Some symptoms of when you have low levels include constant feeling of being tired and muscle aches. Vitamin D can be measured in the lab in one of its forms, and depending on where you are, the lab will have set values to show when you are deficient or when you don't have enough or when you have enough. In terms of treatment, as I've mentioned before, sunlight is the best source. So if you do not live in those areas where you have sunlight most of the time, then you might need to take supplements to help you to make enough vitamin D, especially in the winter months. To know how much you need, To convert from international units, you can divide the international units by 40 and you will get the amount you need in micrograms. So on average, between 400 to 800 units should be adequate for maintenance of an adult. Higher values like 1000 or 2000 units might be needed, like those that have bowel problems in absorption and other conditions. As I mentioned earlier, food is also a rich source of vitamin D, and things like cod liver oil can provide between 2.5 micrograms and 20 micrograms, which is between 100 and 800 international units. You do need to be aware that the amount of vitamin D in the body, the time needed to reduce by at least 50% is 2 to 3 weeks, which explains why in the winter months or the colder months where there's not enough sunlight, what you have stored up during the summer will not be able to sustain you. I hope you enjoyed this video. Don't forget to watch again, share, and subscribe to my channel. And until next time, smile because it's healthy. Bye.